Assalamu alaikum, everyone. Today we have two special guests with us. We have Dr. Zara and we have Dr. Mayur. Both of them are trauma surgeons. Where were you born?
So, first of all, assalamu alaikum. It's a pleasure to be with you. I was born in India, and I moved to the US when I was 4 years old. And my journey has taken me to many places across the globe, but this is my maiden trip to Pakistan and my maiden trip to Karachi and Aga Khan.
Amazing. And what about you? Where were you born?
Yes, assalamu alaikum. I was born in New York City, and I also kind of took a circuitous journey to trauma surgery. But I'm delighted to be here. This is my first time.
We're delighted to have you guys.
Thank you.
And what kind of kid were you? Were you a New Yorker?
I was a New Yorker. I grew up in New York City. I was born in Brooklyn.
Awesome.
And I grew up in Manhattan.
Nice.
Central Park was my backyard.
And do you have any amazing memory that you close your eyes and you can memorize it again?
Yeah, actually, my favorite place in all of New York City is the Reservoir in Central Park.
Oh, nice.
And it brings me a lot of peace and joy and comfort whenever I'm there. So whenever I'm back in New York City, I always make it a point to get back
there. Yeah.
Yes, and even having grown up in Manhattan, I am amazed by the traffic here at Karachi.
I am sure. What about you? Any amazing memories?
I grew up all over the States.
Yeah.
In fact, I moved every year and a half between the ages of 4 and 12.
Oh, okay.
Both from East Coast, West Coast, Midwest, and then back to the East Coast. So I remember traveling the country by car and seeing so much of it. In fact, I've driven through every state except 2, and that's Hawaii and Alaska.
Oh,
with my parents. And
so, nice. What about, do you remember the first 4 years of your life?
Actually,
vaguely?
Not as much, only through pictures.
Okay.
But I travel back a lot, so hence my ancestral home is still there.
And what kind of a kid were you? Were you an introvert, an extrovert?
No, I was always been an extrovert. Although most people will say I'm an extrovert, I do like my own quiet
peace,
time,
yeah.
and I keep my friend circle very close.
And what got you to med school?
I had an uncle who I had met in Illinois when I was a 4th grader, and he was not a family uncle, but just somebody we had met. I would say near neighbor, and he was a pediatrician.
Okay.
And for the next 10, 15 years of my life, I thought I was going to be a pediatrician.
Oh,
until
okay.
I got to medical school.
Interesting.
And then I could not deal with the patients' families. My goodness. And then I fell in love with surgery.
What about you? What made you go to med school?
I had the opportunity to shadow a neurologist after I had graduated from college. Actually, I was doing
marketing.
I was working.
Yeah, I remember.
Yeah, and I was doing some volunteer work. And as part of that, I shadowed a neurologist who was doing research in amyotrophic lateral sclerosis. And my plan was to write about it, but I was so captivated and deeply impressed by the relationship that he had with his patients and that his patients had with him. It was really a life-changing event. And so that's what kind of ignited the spark. And after that, I looked into it. And
is that where your love for hospice care
actually,
came from?
No, it's so ironic because I would never be a neurologist and trauma surgeon.
Yeah.
Right? But my love for hospice and palliative medicine, more palliative medicine than hospice, really was born from my early years as an intensivist and wanting to expand my skill set as a physician, as a critical care physician, being able to really help my patients and their family through their entire journey.
How do you, I don't know, how's the notion there, but here a lot of people think that surgeons don't think, they just cut.
Yeah.
And when you talk about intensive care and you talk about hospice care, that's a lot of care, medical care that you provide.
Yes. One of the things that sometimes I'll hear people say is they'll separate surgery from the cognitive specialties.
Yes.
And that drives me absolutely bonkers. So I think, the reason I went into general surgery initially is because I wanted to be a physician who could cut to cure. And in fact, I think of us, and I think of trauma surgeons in particular, as having the ability to work in these interdisciplinary teams, kind of across specialties and across fields, and to collaborate to take care of the most severely ill and injured patients to do exactly that kind of cognitive work. So I ignore them.
Med school. How was med school?
So, I knew I wanted to do medicine, and I only applied to programs that guaranteed me a seat out of high school.
Okay.
And actually, it was very fortuitous because when I did that program, I met my mentor, and who's been a huge inspiration for me in my career, and actually a mentor for both of us, in Dr. L.D. Britt. And so, but my journey to trauma happened in fourth year of med school. I lost my aunt and uncle to a car crash in India, and they were taken to my own family hospital. And I still believe today that had the treating physicians had the training, that they may have been alive today. So that's why I chose surgery, and I knew then that I was going to do trauma and then global health.
This may be a very cliche question. Have you ever watched Grey's Anatomy?
A little bit.
One of the last episodes there is when the
gets
shepherd,
hurt.
and he has
Yep.
brain injury, and they don't get a CT scan done, and he dies because of that.
Yep.
So, probably that's the same thing that happened to your uncle, right? Sort of like
sort of in the sense they had internal hemorrhage. They were complaining of abdominal pain.
Yes, and
they focused on the obvious extremity injury.
While you were telling us yesterday, I was like, oh, good. Wait, did they have a fast? Did they have a fast? That was I was screaming while you were telling us that yesterday. And
what they had was a slow death.
Yeah.
Nothing was fast about their care.
Yeah. But having had that notion behind that, I need to make this better. How has your struggle been? Have you struggled, or has it just been a breeze in the park, walk in the park?
No, absolutely. I think that, the older I get, the more comfortable I get with explaining my journey. Dr. Cooper and I were chatting, for the youngsters who are listening, there's always going to be challenges along the way. People walk into my office now and they see all this stuff, and I said, listen, don't be enamored by any of this. It's blood, sweat, and tears.
Yeah.
And there's no substitution for hard work. And so at any time I've taken the pedal off the gas, that's when the ultimate physician reminds you and says,
I'm in power.
I'm in power. And so it's been a combination of my own passion, my life experience, the loss, and then my mentors that have just molded and guided in the experience. And it's been the best thing. It's been the best choice of profession for me. It aligns with my values. It makes me tick, and I couldn't see myself doing anything else.
Yeah. Throughout your journey, you might have, treated a lot of patients. Has there been any patient that has always stuck with you, or you like, this is one patient that I really remember, or?
Yeah, there are a few. There are even some from medical school. I think there are those patients that you learn from because you have been tested in caring for them.
Yeah.
Whether that's that they didn't have an outcome that you had wanted or they surprised you. And there are also those patients where you make incredible bonds. I find sometimes because they're so different from you, that you really kind of are struck by the ability to care with them and care for them. But yeah, absolutely, there are patients who stuck with me. I don't think you lose that.
Yeah, you don't.
Or I hope you don't.
Yeah.
I hope you don't lose that, because that's the humanity of what we do. And you need to have those connections. That's why we do it.
So as physicians, as surgeons, we come across, we do a lot of work. We come across patients who sometimes don't do well. What's the drive behind you wanting to do better? What makes you not stop what you're doing?
Oh gosh. I think the first thing is approaching it with enough humility to realize that as long as you're doing the best that you can do, that's not always going to solve the problem. In fact, we don't make the ultimate decisions.
Yeah.
And so, I think having the humility to recognize that it's not all in our control. But what is in our control is what we bring, how we show up, how we are dedicated to our craft, how we are dedicated to our patients, how we are dedicated to caring for them and their families in these critical moments. And so that is something that, to your point about this being the best profession, you just don't get that in a lot of ways. One of the things that I love about surgery and that I love about trauma surgery is that it's always an honest day's work.
Yeah.
Right? Every day you're using your head, you're using your heart, you're using your hands, you're trying to do good for somebody, you're trying to make the world better. I mean, that's very gratifying, and we take it for granted because it's not hard. I mean, it's not easy. It can be very, very challenging and very hard. At the same time, I feel like if you don't have those lows, you start to underappreciate the highs, and just kind of all that we gain. I find it a very selfish profession, actually.
Yeah.
I would just add that, how do you keep yourself ready? If you believe in every spiritual scripture, around the globe will say this: full attachment to the process, no attachment to the result.
Yeah.
If you think about that for a second, it means that you do your best, just like Dr. Cooper said, but the result many times
are not in our hands.
It's not in your hands.
Yeah.
Now, part of that process is staying up to date.
Yeah.
Part of that process is refining your skills.
Yeah.
Part of that process is being prepared, guiding your team, all those things. So, when you talk about process, that is part of our process, and that's a calling.
Yeah.
We chose this profession, or the profession chose us.
Yeah.
And where I get frustrated with some of the folks who are coming behind us is when I see that they lack that, that sits very difficult with me. And I think with Dr. Cooper as well. It's just a disconnect.
Yeah, there is. How important do you think is having a good mentor? Can there be just one mentor, or who do you call a mentor?
So I'll take that first. I think that it's we stand on the shoulders of giants.
Yeah.
We didn't create this specialty.
Yeah.
We learn from each one of the people who trained us, the pluses, the minuses. But I do think that mentorship is important, sponsorship is important. And there's a distinction.
Yeah.
A sponsor is somebody who's going to champion you in every phase of your career, not just opening doors, but just really, really, really vying for you.
Yeah.
I think both are important. But I'm not a product of one mentor, although I have one primary mentor. There's a whole slate of mentors in different phases of my career, in terms of starting out my career, then mid-career, and now even at this stage, I'm still getting mentored. And so I think that's how I would answer that.
Yeah, I agree. I mean, I think a mentor is critical, but a mentor is not just critical for your professional life. I mean, mentors in all aspects of your life are really, I think, underappreciated and undervalued. I mean, I have mentors who have mentored me through mothering and motherhood, and the mentoring relationship is unique because it really is about the mentee. The sponsorship relationship is a little bit different. It is a little bit more transactional, and people need to realize that when somebody is sponsoring you, you need to do right by them. They're putting their name out and their neck out for your success. And so the distinction there, I think, is very important, and it plays different roles at different points in your career. I absolutely do not think you should just have one mentor, and it's one of the things that's so incredibly gratifying is to see your relationship with your mentors evolve over time.
Yeah.
And so, individuals who had mentored me earlier in my career are now my friends and my colleagues.
Yeah.
Peer mentorship is incredibly important. One of my nearest and dearest peer mentors is Dean Hyder.
Mm-hmm.
And also having mentors who are outside of your institution, who can provide you with perspective that you don't necessarily have outside of your specialty. So there are lots of different ways to get mentorship.
Yeah.
Excuse me, but I highly encourage individuals to be deliberate about developing a mentoring team and recognizing that you need mentorship at various different stages for different things.
Yeah. What Dr. Adil Haider calls this is you need to have your own group of people or your own caravan while you're going through whatever path that you've chosen for yourself. And having that caravan is very important. You need to know, all of those people who would be there, would stick by you while you're going through your path.
Yes.
So I think that's really valid.
Solid advice.
Yeah, solid advice. These days we talk a lot about mental well-being. What are your 2 cents on that?
Yeah, I think that it's a lot of it speaks to your core.
Yeah.
What keeps you not burnt out?
Mm-hmm.
And for me, it's doing things with culture, music, doing satsang, as we call it in Hindi, which devotional singing, music. My family did soup kitchens every month growing up.
Nice.
To give seva, which is giving back.
Yeah.
And we still do that as a family. So I think that those things connect you to, because otherwise, if this profession is a 24/7, 365 profession, it has the ability to swallow you whole.
Yep.
And if you don't take the time to reconnect with the things that you enjoy, then you don't have mental well-being. I think it's spending time with family, my kid. I see God in my kid, and spending time with him and my wife, and my parents who are still lucky enough to be with me. Those are all part of the well-being. I think that gives you the strength and the fortitude to deal with all the external things.
I think that it is important that we recognize the high rates of depression and anxiety and PTSD that are within, the house of surgery globally. The areas where the individuals who are extraordinarily burdened by some of the, real deficits in our profession and how we function as in healthcare provision. And what do I mean by that? Just kind of the very long hours without time to break and collect and calibrate,
and breathe.
and breathe, right? And the expectation that you're going to go from thing to thing to thing to thing to thing. And I think that well-being means that you have to give yourself the time and the space that you need to recalibrate. But it doesn't mean that you're always going to be happy. It doesn't mean that you're not going to be stressed out. It doesn't mean that things aren't going to challenge you. And I do think that we need to keep some perspective on that. This is not easy. Life is not easy. Things that are worthwhile are not easy. They're going to challenge you, and you grow through challenge, and you grow through trial and tribulations. And so if you are somebody who expects that, who thrives, who needs that kind of growth, then you need to recognize that there are going to be ups and there are going to be downs. And if you've ever trained for a marathon, I mean, that is exactly what it's like, right? And so this is a marathon. It's not a sprint. It's not always going to be easy. That's what makes it valuable. That's what makes it worthwhile. That's what makes it so highly valued. And so I think we also need to keep some perspective around that. But I do think that there is greater attention towards well-being in our field, and it is definitely a huge, huge shift in the right direction.
I mean, it's first time in a long time where people openly acknowledge. Some people.
Yes, some people. Right.
Openly acknowledge, and the reason I say some people is Dr. Cooper and I, come from an era where sharing those weaknesses that you had internally as minorities, there was, let's just say, there was no margin for error. And so, whereas even now in 2024, some of our colleagues feel comfortable sharing because they have a platform. And there's something to be said for that. And so, it's becoming more, but there's still a long way to go.
Question for you. As a woman, have you had or have you ever felt that you weren't in the right profession? Did you have to deal with all these barriers that we talk about when we talk about gender disparity and all the things that women surgeons have to go? Did you have any challenges that you had to face?
Absolutely.
You did?
Yeah, absolutely. I mean, the challenges that I've experienced are often more subtle than you might have heard. So the first thing I would say is that there's some really beautiful work that was done by some sociologists looking at hierarchical professions or hierarchical scenarios where women are in what happens when a woman is positioned at the top of that hierarchy. What happens to their relationships with other women? And so what I will say is that, some of the toughest experiences I've had have actually been with nurses, right? Have been with nurses, have been with ancillary staff, have been with, individuals as a whole who don't expect to see me there.
Yeah.
And so, even in the operating room, one of the things that I say to my trainees is, it's not shouting, or I will say in the operating room, I am not shouting, I am speaking to be heard.
Yeah.
Because oftentimes when I don't shout,
Yeah.
I am not heard because people are not listening for my voice.
Yeah.
And, people find that, I can be very direct, because if I'm not direct,
You won't listen to me.
people won't listen to me. And so, I have had to adjust how I show up in ways that I would not have necessarily in order to take the best possible care of my patients.
Yeah.
You can see even my voice has changed in speaking now, right?
Yeah.
So I think that's one piece. But I do think that there are other challenges in just the structure of our profession and what the expectations are, particularly in academia. For example, I will say this example: our major trauma meeting is in the middle of September every year. That is the start of school. It is a disaster. And having women as presidents has not moved it.
Yeah.
Right. But there are lots of things like that where, had the profession, had the phenotype of the profession been different,
it might
the
have.
whole thing might look different.
Yeah.
And
So I have a question for you before you say something.
Okay.
So, so if you scream, supposedly I'm one of your residents, you scream at me, I've done something wrong, and she screams at me. So normally what we've seen is people would say, because I made a mistake, you screamed at me.
Yes.
She's probably having PTSD or she's PMSing. That's the notion that most of the women get. What is your notion on that? And how would you stop that?
So it's interesting.
Yes.
First of all, I rarely, if ever, yell. If I do,
No,
the
we're-
world is burning down. But I will tell you that there is something to say for perception.
Yeah.
And I'm, as a mentor to many women surgeons, it's a huge struggle. And Dr. Cooper has underscored it a little bit, but either you're too nice,
Yes.
or you're
Either you're soft
you're
or
aware
you're-
that we can't
Or
say,
Yes.
you're hard.
you're hard,
Or you're hard.
and there's no middle ground.
Yes.
And at every step of the way, people are challenging you because, as Dr. Cooper said, they may not expect to see you in that role.
So how do you as a man stop that?
So I think that, first of all, as soon as you see it,
Yeah.
one thing that I've always said, I'm consistent. If you allow behavior, even if you are not the one doing it, if you allow it in your purview, then you are just as good as doing it.
Yep.
And I will tell you, people in my orbit know that there are expectations of how you are to, and that comes from my training, that comes from my people who train me.
Mm-hmm.
I have zero tolerance.
Mm-hmm.
And people, when I'm in the room, will act differently because they know that the boss has expectations, and I will not be shy
So
to
the
call
same.
it out.
I'm sorry. If those same expectations, if I'm that surgeon and I have those same expectations, I'm probably bossy and I am too proud and I am probably not competent enough, and that is why I'm masking it. That's what women get to hear. Why is that?
So-
Why cannot we break that? Why
So
can
I
she
think-
not be confident and be the same, as you are, just because you're a man?
Yeah, it's interesting. There are some just inherent differences between the approaches. Right?
Yeah.
And that goes to our characteristics of how we are different
Agreed.
sexes, right?
Yes.
In terms of X, Y, X. That doesn't mean that, the masses, that we can control. What we can't control is everybody else's response.
Agreed.
Right?
But what we
Because-
can control is our own
but
response.
think about it for a
Yeah.
second. You, by virtue, and what ends up happening many times is, after repeated understanding of the person in their role, then many times they're often beloved, right? Because, I love Dr. Cooper, I love Dr. whoever, right?
Yeah.
But in the initial stance, right, there's always, there's a challenge that many times people face, just like you're alluding to.
Yeah.
You can't change their mentality.
Yes.
There's no amount of coaching that can say, she's changed your perspective because but what you can happen is that the way you handle yourself, the way you control the room, the way you treat people, and the people who are enabling you in that room, if they're welcoming you and they witness this behavior, they have to call it out.
Yeah.
And as soon as you get checked once, then you think twice the next time.
Yeah.
So if I'm in the room and I'm introducing you
Yeah.
and saying she's my assistant professor,
Yeah.
and I see or I sense,
Yeah.
look at what I'm telling you. If I see, I hear, or I sense
Yep.
that there is anything else except respect
Yes.
and an act of professionalism, it's my duty
Yep.
to call it out.
Agreed.
I will say that the part of the onus is on us, which is not fair.
Mhm.
Life is not fair. But I would say that most people in these settings don't necessarily even recognize when they're seeing or hearing behavior that is
Yeah.
disrespectful, because it's so ingrained.
Ingrained. Yeah.
It's so ingrained. And so there are times when we need to identify allies
And step forward and say it out loud.
and step forward and say it out
Yeah.
loud. There are some people who, as Dr. Narayan says, you can't necessarily coach them through changing their perception. But if you can identify leaders who are allies and explain to them what's happening, then I've seen really
Change
the
happen.
ability to make change.
2 last questions.
Yeah.
What will you tell your 10-year-old self if you go back and have to talk to that 10-year-old?
Be happy. Be happy and follow what you want to do. That's what I tell Brigham.
Mm-hmm.
Right? Before I go to bed every day, are you happy? Because honestly, the rest of the stuff, the pressures, the success, all that stuff will come.
Uh-huh.
Right? I just want, so I would tell myself that.
Yeah.
Be happy and enjoy life, because we are the dash between the two numbers. You know what that means?
Beginning and the
Birth
end.
date and your death date.
Yeah.
The whole life is in that dash.
Yeah.
So how you experience life and how you experience it, live it fully.
Yeah.
But be happy doing it.
What about you?
What would I
You call me.
I would tell my 10-year-old self, can you believe this? That's
Nice.
what I would say.
Amazing.
That is really what I would say.
Yeah, mashallah. Last question. Any message for the people, residents, consultants who are seeing you guys, students? Any message for them?
I would say that, this journey, I've been asked a number of times if it's changed my perception of Pakistan. And it hasn't, because I didn't come here with, preconceived ideas of what I would find. But what it has done is absolutely overwhelmed and inspired me, because every person that I've met has been, not only incredibly gracious and kind, but just so committed and so devoted to this work, and really solving problems in some of the most creative and really remarkable ways that I am learning so much that I cannot wait to take back.
Mm-hmm.
And so I wouldn't say that it's changed my perception, but it has, just overwhelmed me with gratitude for the opportunity to be here and to meet with all of you, and just real a sense of pride that we share being in the same profession.
Yeah.
I would tell the youngsters, look, you're entering a profession that is God's work.
Mm-hmm.
It is. That's what I tell folks who get to know me, and that you have the ability to make differences in people's lives.
Yeah.
You have the platform to do so. It's going to be full of challenges. I know many of the students and residents who are listening want to pursue their residency abroad. There's challenges that come with that.
Yeah.
And the numbers game don't necessarily always work in your favor.
Mm-hmm.
But that's when you take guidance from the people around you.
Yeah.
And also look within.
Yeah.
To say that maybe it's, not everybody can go to every place and fill those positions.
Yeah.
Some people, there may be work that the ultimate source is telling you that has to be done here.
Yeah.
Right? And you and I have talked about that a little bit.
Yes, we did.
So I would just tell the youngsters, think about service. Think about service to your kith and kin. Think of your patients as your family. Think about service to your country.
Mm-hmm.
And I think you're a fine example of that. Getting your training and coming back. And Dr. Cooper and I visited the Indus hospital yesterday, and we saw the unbelievable work. And you know what? We say love in action.
Yeah.
There's so many examples of that happening
Yeah.
because the need is great.
Yep.
And so I'd say that it's the best profession as long as you take it with the right mindset. And that's my parting word. It's been an outstanding visit.
Thank you so much. Thank you so much for giving me your time.